Well, hello, 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 and good afternoon, good evening, good day, good whatever it is. This is Kania Kennedy, and it is Wednesday, April 4th, 2018, and it's the Fertility Family Live. Yay! So happy to be here today. As I am every week or every opportunity I get a chance to move forward with this ministry. We're going to get started with our special guest today, but a little housekeeping before we jump right into business. The Fertility Family, what is it all about? Why are we here? In case this is your first time joining us, going to share a little bit about that. Share, yes, that's what we're going to do. All right, so this is the Fertility Family Live. We get together once a week to talk about all things related to having happy, healthy pregnancies and babies. The Fertility Family was created the end of last year. Well, let me just back up a little bit. Back in about 2016, even before then, we go all back to my mid-30s. I'm 42, you guys. I just turned 42 in March. And by about 35, 36, was looking kind of like, oh man, I am not married. I don't have any children. And being a mom is something I certainly wanted to do. And I knew at the time that I definitely wanted to have at least one baby biologically. And so I was talking with my sister at the time, and we were kind of like, she also was single, no kids. We're like, okay, well, how are we going to do this? Continue the family's legacy. And so we agreed that I would have the baby, and we were going to raise the baby together as sister mamas. Well, but the ideal solution was still we're going to find this awesome life partner, and we're going to do this more traditionally. And life has unfolded as it has. My sister transitioned in 2013. And so that kind of put my plans a little sideways. I had to regroup and think about truly solo parenting. And still was very clear, this is what I want to do. So 2016, after doing some healing work and kind of recovering from an unexpected loss, it was like, oh, we have to do this. How does one do it? And one thing you definitely need is support. So you have concerns about age, about doing it on your own. You may be having some issues conceiving. You may just be like, I don't know anything about pregnancy and I want some support. Wherever you may fall in that spectrum of things, this is why we're here. This is what the Fertility Family is about. Basically having a happy, healthy pregnancy and baby. So if you're someone who's been having some challenges with conceiving and maybe you may not have the means or you may have exhausted your means, going a more traditional route or a more conventional or modern medicine route, we have healthy, natural, and guess what, you all, affordable solutions to deal with fertility challenges. You do not have to bankrupt yourself having a baby. If you're mature or maybe a first-time mommy and you've got some concerns, Fertility Family is for you. If you just like to plan, like I'm a planner as well, as you can tell, I was thinking about this 7 years ago. Our Fertility Family is for you. In fact, when you join the Fertility Family, you get a free copy of our pregnancy timeline, which takes you from about a year out, everything that you need to be thinking about to have a baby, and then even takes you into the first 3 or 4 months of pregnancy. So an awesome resource. And then every week we have Fertility Family Live, which is where we bring different experts around pregnancy, conception, early childhood support to come and answer any questions and present great information. And then inside our group, which is a members only group, you can ask questions there and post information there, and we post resources in there. So it's an awesome resource, awesome group. I'm really happy to be here. A couple of things we have our Foods That Make You Fertile, which is an awesome document I put together. So if you want to eat for fertility, you got information around that. For people like me who will be doing solo parenting, or if for whatever the reason you may be in need of donor sperm, information about that. If you're just getting started, or if you already know you're having some feminine challenges, or you know any woman in your life who may be dealing with things like cramps or endometriosis or PCOS or just really bad PMS, consider that we're not supposed to experience any of that. So we've got our holistic feminine health starter kit so that you can have a happy, healthy honeypot. So our goal is to really provide a lot of resources for us to be successful in our quest to have babies. And inside of that, this week we have the fabulous doula, Miss Akilah Shaheed. Woo, woo. And so she is our live expert today. And she's going to talk to us today about breastfeeding, I believe is the topic, and peer support around that. I want to share, I always love to share a little bit about our experts, because if this is your first time catching us, you may not know like the blessing that you have here for you today. So Miss Akilah Shaheed, who I met a couple years ago at a wellness event in the community. She's a beautiful spirit, great energy, a lovely woman. And when I was thinking about the fertility family and thinking about doulas, of course, she jumped into my mind, and whoosh, here she is. She is a West Coast girl. I met her down in Atlanta, but she's born and raised in the East Bay area of Northern California. Her nickname is Black Panther Flower Child. So she's a peaceful revolutionary is how, that is how I interpret that nickname. She's all about advocating for the rights of others. And so she became a doula after having her own experience of birthing injustice after she delivered her son in 2009. She's worked in the medical field, and in 2015, she was like, boom, let's do this. And her goal is to change the narrative in birthing outcomes for women of color. We'll talk a little bit about some of the things that are going on with women of color, and in particular Black women, as it relates to mortality rates related to giving birth and maternity, which is actually pretty alarming as I started doing some more research on this. She's worked as an assistant director for a More Excellent Way health organization, and that allowed her to become a breastfeeding peer counselor. Okay, so, and introduced her to the idea of a doula in the first place. So over the last few years, she's been assisting families navigating through the medical care system and creating their own spaces if they want to do home births. Her goal ultimately is to become a traditional birth attendant, also known as a midwife, so she can continue to help women catch their own babies, which is something I would love to do. I don't know if I'm that gangster, but we'll see what happens with Baby Fabulous. But I'm so excited to have her here. She always brings a smile on my face when I think about her. So without further ado, let's talk more action. Miss Akilah, don't forget to unmute yourself and welcome.
Thank you. Thank you. I like it. I think I'm going to coin the term peaceful revolutionary. Absolutely. And you are definitely gangster enough to catch Baby Fabulous. So, yes, ma'am. But greetings, everyone. Today, yes, I put together an awesome presentation that I hope will definitely benefit you guys. We're going to be focusing on postpartum support, and of course, that comes with breastfeeding. So without further ado, I think we should jump into it. And you can see it. We can see it. Yes, we're good. So postpartum care and support. What does it look like? We're going to discuss the physiological changes in the mother, the physiological changes in the newborn, psychological changes in the mother, the newborn in the postpartum period, and also maternal recovery. And so puerperium, that is the 6-week span. When we're talking about recovery of mom, 6 weeks, you're able to become sexually active, but we're more focused on what is going on with mother during this time. I want to make this big. And so the first focus, actually, hold on, I'm having some technical difficulties on my end. Here we go. Is involution. So as you can see the picture on the right here, do you see how large and how swelled the abdomen would look? If you can pass through the layers, this is actually the womb. It expands to this size. So the womb, or the uterus, is what we're referring to. And so 6 weeks is about the average time that it will return to a normal size. Also a normal tone, meaning your muscle tone, that is referring to your ability of your muscles to work, and also the position. And so we go from here within our womb, and we're expanding and stretching throughout a pregnancy. And so this entire area that you see my pointer moving, it's stretched that large. It just goes to show you how awesome and how beautiful our bodies are. And so the muscles in the pelvic floor, which are aligned underneath here, and the ligaments and the tissues of the vagina also have to do some shrinking. And so they have to return to their non-pregnant state during the time. This is when milk secretion within the breast will begin. So while some women do have a little bit of leaky breast, that's what I call them, during their pregnancy, it really is the colostrum, which is the first identifying milk secretion, and that's called the gold and nectar honey, because it's filled with so many vitamins and minerals that baby needs for those first few days, and then they do change. Outside of that, the other changes of the body include the urinary tract, the musculoskeletal system, and the circulatory systems. So during pregnancy, our circulatory system is put under a lot of stress as far as our musculoskeletal system and the urinary tract system. So that's why we tend to have to urinate more. We can't exactly hold our bladder how we used to. And so this is that time within those first 6 weeks that we really want to focus on self-healing. So all my busy moms out there, when you're starting to think about conception and pregnancy, really start to think logistically how you can learn to take a seat. A lot of us tend to move. Oh, and I just wanted to explain, so the uterus weighs about 2 pounds immediately after birth, and we want it to drop down to 0.14 ounces. So if you can just think about that change and how drastic that is within a 6-week period, it's very, very important that we focus on healing and hopefully breastfeeding. So to the left in this column, we're going to talk about and discuss discharge. And so normally, and this will tie into what Kania was talking about our maternal mortality rates and what's going on with that. So there is a standard discharge that varies, and it can vary from colors red, brown, and yellowish white, and it can also go back to red. So there is going to be normal bleeding, which will be the shedding of the placental site tissues. Now, when further on in the discussion, I will talk about womb massage. And just to give you a little bit of more information, I experienced my birthing injustice due to my placenta being prematurely pulled. And so the practice right now in modern medicine is to pull the placenta about 1 to 2 minutes after the baby is born. But we can healthily deliver our placenta anywhere from immediately after birth up until 2 to 3 hours after. And so what we want women to become aware that they do have the right to say, you know, I'm going to naturally deliver my placenta.
Oh my goodness, we've lost the fabulous Akilah Shaheed. Most likely something technical going on. I'm sure she'll be back soon. No worries. In the meantime, I'll share a little bit about some of the things that I know around postpartum support. Now, this is an area I haven't done a whole lot of research in yet. Just send her a quick note. I've done a whole lot of research, but I have done some. So a lot of the times what we hear about or what people worry about inside of having a baby is quote unquote snapping back. And during this 6-week time period that she's talking about, the body's doing some readjustment. And one of the things that's important for us to have in place, which is why we have the pregnancy planning checklist, is to make sure we have support in place around that time period, because you've just gone through a major experience. Now, if you're in a fertility family, you're going to be in really good health, because what we're doing is a lot of pre-pregnancy and even during pregnancy practices that are going to have your health and your well-being be optimized, so that by the time we have the baby, we're going to be having great maybe even painless pregnancies. There's a diva I'm in communication with right now, and her specialty is painless birth. I'm like, I definitely want to know about that. So, in ideal scenario, we've released our baby, we've brought forth our baby into the world, and we're not as traumatized as we might think we're going to be because we're doing things non-traditionally. We're doing things not according to maybe what modern medicine would have us do. And instead, we're putting in some ancient practices as well as maybe some newer but more cutting edge practices that would have our pregnancies and our birthing process be smooth. But there are a couple of things. So one, there are some herbs and things that we can be taking starting about 5 weeks before we're scheduled to deliver. Of course, babies come in their own space and time, but there's some that we can start taking about 5 weeks out. So ask me about 5W. And what they're designed to do is to help prepare the uterus and the body for not only giving birth, but also this what she called the involution, or I would call the snapback period. And it's important that we know these things because a lot of the times modern medicine doesn't always believe in, or many times they're not.
Talking to myself that whole time? Are we back?
Hello, fabulous. That's girl. I was okay. I was, so the last thing we heard from you, you were. I have no idea what happened, but it's okay. I was talking a little bit about what I call the snapback period, which maybe is officially what you're calling involution, and just some of the things that they could be doing to prepare. One thing I just mentioned was that there are some herbs you can start taking about 5 weeks before you're anticipating delivery. But I was just, girl, I've been doing research. I was just sharing a little bit while we waited for I'm holding the space for the technical details to, begin to work itself out. So yeah, you can hop right back into the presentation.
Okay. Thank you so much. I'm like, and I was just going, I was on a roll, you guys. I apologize. In retrograde. So if any of you guys have been, out of whack as far as communication, or as you can see, technical difficulties, April 15th is when we're supposed to feel some relief and everything is going to go back. Yes. So praise to that. So it's coming up. So let me pull it back up. And yes, so about 5 weeks prior, I don't know which herbs you mentioned, but I tell my clients to go ahead and stock up on alfalfa and nettles. And yes, so we really want nettles and alfalfa, and you can use it within a tea. That's very good. Once again, as you'll see on the screen. Can you see it? Can you see it? Are we good?
We're there. Oh, wait, you went away. Oh, well, that might be me, actually. Let me switch.
Okay, wait. Okay, I see it. You can see it.
Okay. Yeah, you're good to go.
Okay. So yes, as we were talking about, the snapback, or technical term involution, is within that first 6-week period, and it refers to the uterus returning back to the normal size, tone, and also position. So I am also a womb placement practitioner. And so sometimes, depending on, and mind you, this 6-week period and my presentation is based off of a natural birth with no interventions and also no trauma.
Akilah?
Yes.
Where you were, I just remember exactly where you were. You were talking about the natural delivery of the placenta up to 2 to 3 hours after giving birth.
Okay. Gotcha. We are, yes, we're right here. I was talking about, yes, so the increased bleeding. So I wanted to go ahead and relate the maternal morbidity rate in relation to hemorrhaging, which happens about 2 weeks after delivery. So these moms are at home and are having a hard time identifying what is normal bleeding and what is an actual hemorrhage. And so the normal bleeding will increase from 7 to 14 days postpartum, and that is your placental site tissues. And so what I wasn't able to have was for me to naturally dispel my placenta. So what ended up happening is that it was pulled. And so while it was being pulled, my placental site tissues came out with it. Now, within a normal delivery, you would pass these about 7 to 14 days postpartum. They may look like a little bit of clotting. It may get very, very bright red, and it may also be the brownish, like old blood. And so that is what I was trying to explain. And then our breast changes. So what happens immediately? Immediately after delivery, you have colostrum, which is not going to come out as liquid milk as we would think. How it looks, it's actually a thick, sticky substance that is filled with beautiful vitamins and nutrients that our babies need within those first few days. At day 3, this is with women at home, why we love for them to have support, whether that be a close friend or relative who has breastfed, whether that be a doula, or whether that be a beautiful nonprofit organization like Rose, which is reaching our sisters everywhere, or Mew, which is a more excellent way health organization that comes to your house and does house calls to assist you on day 3 so that we can avoid engorgement. What engorgement is engorgement is when your milk comes in at day 3 and you can tell it's there, but it is so filled up that you cannot get it out. And baby has a hard time latching in order to get the milk out. And so what I would love for you guys to start researching and even practicing with is hand expression. And I wanted to switch it so that you can see me kind of give, hey, there you go. Can you guys see me? All right. All right. To see what hand expression would look like. And so, of course, I don't have breast milk right now. But on day 3, mom or dad or her support person, whoever she's comfortable with, is to go ahead and warm their hands up before touching, of course. And please go ahead and wash them unless you're mom. Yes, you're going to wash them and warm them up. And you're going to start actually underneath the armpit. And you're going to push forward. Push forward and start massaging. We want to get used to moving and touching our breasts and getting in them. And then you're going to cup. This is around where my nipple is. You're going to cup, push in, and then squeeze out. Okay? And just start doing that during your pregnancy. Go ahead and do it. If you're around 4 months, you may start to see that you'll leak. And so we want to kind of get in the used to, using our body and learning how it works. We have beautiful muscles in there, and they're asleep until we engage them and until we go through this pregnancy. And day 3, once again, is when that real breast milk forms, and that's going to help give your baby that weight that doctors always talk about. So it is normal that baby is going to drop weight between day 2 and day 5, and then they're going to start to pick that up around day 6 and day 7. Really, when we're talking about breasts, it's not supply and demand, how we're used to our economy. It's demand and supply. So the way that we demand that breast is by using that exercise that I just showed, hand expression, also continuing to have baby around the nipple, latching on the nipple, stimulating the nipple, because those are all healthy things that we want. Excuse me. What happened? There we go. The urine pass. So a lot of women are not familiar with what's called the urine pass. But what happens is once you get home about immediately after, you are going to lose a lot of the estrogen that you have built up over your pregnancy. And that is going to cause you to urinate it. And so you're going to start urinating a lot. And we want moms to really to drink hot, warm teas and a lot of water during this time, so that you can take care of this beautiful milk supply that you're going to have, so that you can breastfeed your baby. Stress incontinence. We're talking about the uterus and also bladder incontinence. So this is the point in time where women may have a little bit of urination if they're coughing. If they're sneezing, if there's extra pressure put on the uterine area. And this is also where we have rectus muscle separation. So remember, we're talking about the first 6 weeks. Now, No sit-ups, ladies. No heavy lifting. We definitely want to be mindful of our range of motion. So if you stretch, please stretch in a manner that is not putting too much strain on your abdominal muscles. So rectus muscle separation is what happens normally during your pregnancy. Your abs are kind of shift and they're going to open. But we do want to give, like we said, within those first 6 weeks, allow them to go ahead and close back naturally. Here we go. Psychological changes. So when we're talking about psychological changes, we are really focused on the two most common issues that mothers face, which are the baby blues and postpartum depression or anxiety. Now, I am a baby blues baby, which means that my mother had baby blues, and this happens around your 3rd or 4th day postpartum, and it can last up to 6 weeks. So it's very important when we're thinking, once again, about planning to make sure that you have the type of support that may require 24-hour care. And so my dad was awesome as the milk supply protector. I call dads or partners the protectors of the milk supply. And he actually had to hold me up on my mother's chest for the first 2 weeks of life because she definitely suffered from baby blues and did not want to touch me. And so what those symptoms look like are rapid mood swings, a lack of concentration, high anxiety, a feeling of dependency, meaning not wanting to be left alone with the baby, and also frequent apologies for normal things that are done. So if going to get a cup of tea or not being able to get up and fix breakfast, it's they're apologizing. So partners, definitely pay attention to these signs. And this tends to happen more among women who give birth in the hospital. Our postpartum depression and anxiety. I dealt with postpartum depression and anxiety, and at the end, I actually included an interview that I did about it. So this is very common, and unfortunately, it's getting the rates are rising as we see medical trauma that's happening to women within the hospital system. And I definitely do think it's once again surrounded around the placenta and the delivery of it, but also once again, just the interventions that we introduce within the hospital setting. So these symptoms look like irritability, sadness and weepiness, a feeling of guilt about something that she felt did not go correct during labor, fatigue and sleep problems. So women that are either sleeping all the time or women that are up throughout the night and, even when baby is sleeping. So the best thing I can tell women to do in order to get rest, because rest definitely will increase your susceptibility to these mental illnesses, is to sleep when baby sleeps. A lack of concentration and forgetfulness, difficulty in focusing, having a reduced ability to make decisions, a development of phobias or unreasonable fears. One of mine, just for a personal account, is that I could not go out to eat at public restaurants. And I wasn't able to assess it until I was in the restaurant parking lot and my mother had taken my baby out and I just could not go in. I actually ended up having a fit. I was really, crying and throwing kind of an adult temper tantrum because I did not want to go. Excessive anxiety, sense of hopelessness, and a lack of confidence with the baby or a lack of feelings towards the baby. So this is why we stress so much about breastfeeding, because if you see on the next slide, breastfeeding helps sustain and balance the normal hormone systems that we have within our bodies. So within this first 6 weeks, a lot is happening physically, but also chemically within the woman. So I've listed at the top a couple of other mental illnesses that we are seeing pop up, and also references and reference points. so that you can become well aware of what's going on with moms, see their success stories, and also read their raw stories and see, you know, what we want to avoid, and if not, what we want to identify so that we can heal and deal with the matter. Because let's face it, we are having babies. We are carrying on this beautiful race of humanity, and we want to be able to do it, you know, with as less trauma as we can, and be able to handle our stress. So this is where doulas really, really come in handy, because this is someone who is objective within your space, who is here to identify the symptoms so that we can treat them and make sure that baby and mom and family is doing well. Vaginal herb steams and womb massages. So a vaginal herb steam is an ancient African practice for women to directly penetrate the vaginal tissues in order to strengthen the womb and reproductive organs. This practice has been widely used in Asia, India, Latin America, and the Caribbean. And as more women tap into their ancestral healing, like myself, we see this practice being used in America for health benefits and spiritual connection. So Ajay man, her sweet spot is absolutely amazing. If you have not visited to Atlanta, right? So make a trip to Atlanta. But if you cannot get out of the house, contact a doula or a vaginal womb practitioner like myself, who can assist you with natural remedies inside of the comfort of your own home during this 6-week period. Now, of course, we would not be doing a vaginal steam that early because we want to once again allow the natural process of the discharging of the placenta and everything else that you have to come out first before we start strengthening it after. But it definitely assists on the balancing of your hormones. There are a lot of herbs that help regulate what's going on emotionally for you. And also spiritually, we do use the vaginal steam as a point of meditation, a tool of meditation, so that you can reflect on your health as a woman and see and assess what's going on with your body and what do you need. So a lot of women that I have been doing vaginal steams for, and when I do them myself, it is kind of like a renewing and a refreshing practice to start to get to know yourself. One's hip closings. So as you can see me on the right, this is my teacher, Maite, who gave me the information about hip closing. Now, she definitely is a pioneer on indigenous practices, meaning that her culture keeps their healing techniques within their village. And she has graciously opened up and began teaching more women about a practice that we have lost during the transatlantic slave trade and during colonialism. We had lost the practice, but it's something that we as women of color were doing immediately after birth. And so as you can see, this was 8 years later that I finally got my hip closed. Now, if you look at the pelvis that Maite has on the left, the pelvis tends to open up. And I'm going to let you see me really quick. Am I here? Am I back? There you go. So there we go. So when we're pregnant, our pelvis tends to open out, right? Because we get into a more of a protective state. And so sometimes you'll see women's the top of the shoulders, like I already have broad shoulders. But when I was pregnant, my whole body tended to hunch over like this because you're going to protect this space, right? We want to make sure that baby is okay. And so the body naturally curves and forms into this. Well, the pelvis naturally opens and expands at the top. So imagine this being the top. Now, when we go ahead and we open and we have the baby and we've delivered, guess what happens? Nothing. It stays open. Your hips stay open. Your pelvis stays open. And so without this closing techniques that puts them back in, we have a lot of women that have strain along the lower back. And so a lot of women, yes, go ahead and ask.
So is this why sometimes like a woman's had a baby and her hips get really wide and then they just stay wide?
Yes, ma'am.
Because I know women who are like, yeah, after the baby. And no one, and so it seems so logical.
Yeah.
But it's so and can you get your hips closed at any time? Because no, you said it was 8 years later.
She closed my hips and I'm sitting up. My posture completely changed. My digestive system started working a lot better. I wasn't holding on to a lot of toxins that I was. And like I said, I was introduced. I literally had this training last year. Nakia Michelle, beautiful doula and DONA certified trainer who trained me as a doula. She hosted Mai Tai in Atlanta. And it was such an eye opener because, like you said, it's something that's like, I would think that the body would naturally snap back all the way in all instances. But it once again reminds us that even though our bodies are amazing, we still have to take active care of them. And that's something that modern medicine had kind of missed. So you may say, okay, I have back pain and, you know, I'm not sitting up as straight, and you'll be referred to a chiropractor. Your chiropractor can laterally align your spine within your pelvis, but they're not going to close your hips. They're not trained within that. This is an indigenous practice that, as you can see, has you lying on my back. She was using a rebozo, which is, here we go, an indigenous tool. As you can see the red right here. And so it's literally, it's part of belly binding, which I'll get to in a second. But hip closing is really looking at the pelvis and making sure that everything is once again lined within a 360 view. So this is a 360 perspective. You see what I'm saying? To make sure that everything is closed and that it's aligned. When you go to a chiropractor, they're only looking at it laterally, if that makes sense. Is that clear enough for it?
Amazing. OMG. Listen, we have to get our natural and we have to keep doing this work.
I mean, and women, and this is a common practice among in Asia. This is, I mean, they do this immediately along with, you know what I'm saying, 40 days of nothing cold. This is all practices that once again stemmed from Africa, but was knowledge that was lost or forced to be lost. And so I'm very grateful that other women of color are now coming out and, first of all, acknowledging where the practice first stemmed from, but also giving us the tools to once again self-heal and heal each other. And so hip closing, it does not matter if you've had an epidural or you have issues. And I want to, as the more that we research, I think our generations of aunts and grandmothers who fell and ended up breaking their hips, I think that could be related a lot to the fact that that they had children and never had their hips closed. So, you know what I'm saying? Years of wear and tear of walking and moving and not being able to be as active as they were after kids. And like you said, of never having those hips closed exactly, I think that could be related. So we want to avoid hip replacements, ladies. So definitely seek a doula or seek a womb massager. And more women are becoming trained. Our belly binding. So belly binding was something that was also new to me. And it is, once again, an indigenous practice. So meaning a practice that happened and that was going on before modern medicine came around. And as you can see, you can use a simple cotton cloth right here. And this is when I would recommend, once again, a doula because she can belly bind you as soon as your involution has finished. So we don't want to do it while you're still raw. So within the first 4 weeks, we don't want to belly bind or put any extra or added pressure. But definitely 6 weeks and after, we want to belly bind you so that, let me share my face again. Let's see. Here we go. Okay. So what belly binding, we'll get a bit intimate, guys. Let's see. What belly binding does is, can you see me? Okay. So I'm a bit good right now, but imagine if all of this drooped. So usually this ends up drooping and we have even my deflated belly. See, I didn't know and I didn't belly bind. But what happens is we take those cloths and it ends up lifting all of this. You see what I'm saying? So this is in retrospect what it could have looked like. And I will get back there eventually. But when women are talking about, you know, they want to use waist trainers and all of these new modern technology, be very careful when you're using that because they may shift your organs. And so what belly binding does is it's a natural lift for your stomach and your abdomen without shifting anything inside. We want, yes, ma'am.
No, you finish your thought.
Oh, okay. Yes, we want everything to once again naturally restore to its normal size pre-pregnancy. And so we want to assist the body and not jar the body. So a lot of the times those, you know, those tight waist trainers, there are some that work, and I actually use a couple, but we're talking about postpartum after the fact. We definitely don't want you to wrap anything that continues to hold pressure and to squeeze everything inside because there's already swelling, there's natural, you know what I'm saying? There's a lot of things that are going on physiologically already that your body can kind of get confused and be like, okay, well, we're just going to put this spleen over here. We're just going to adjust this bladder over here. That's not necessarily, you know, where they would have went if they didn't have influence from outside sources, which would be your waist trainer. So
my questions to ask you today, so I'm so glad you're covering it. Because that's what so womb wrapping is belly binding.
Womb wrapping is different than belly binding.
Okay.
Womb wrapping, yeah. Womb wrapping is direct. It's your lower. Let's see. Sorry, your uterus is just gonna wrap your uterus right here. Mm-hmm. Belly binding, you're gonna come all the way up until it's gonna completely lift everything. And womb wrapping, at least when I'm speaking about it, that's when I use detoxes. So I would put. You see what I'm saying? It's more addressing strictly just the uterus. Yes. Yeah. And belly binding again. Mm-hmm.
I'd heard about these girdle things that people use. So is that kind of what this is, or something totally different?
No, there is a girdle. I think they have the same point. But belly binding is more traditional because, of course, we didn't have the technology or the seams to make all the gadgets of those girdles. You know what I'm saying? But I definitely have been looking into girdles that I would recommend. Right now, I don't have any because one that I tried, it had bad skin. It was itchy, and so that was my only issue with it is that it was itchy. And belly binding, I tend to recommend cotton so that you can still breathe, your skin can still breathe, and it's more of a natural feeling. I don't want you guys to feel, you know, bound exactly, and you're trying to maneuver and breastfeed, you know what I'm saying? But I still want you to tone and be able to lift everything. So that's kind of what goes into belly binding. And we're almost done, guys. It's awesome. But now we're going to talk about baby. So what's going on with baby? And just some key points, because this will tie, I promise, and it will connect all into the reasons why we want to breastfeed. It connects all into the reason why we want to ideally have a natural birth. If you are radical and you're gangster and you're about it and it is legal in your state, I definitely recommend a home birth. But we want to right now focus on physiological changes in the newborn, and we will start with respiration. So we are fully aware that baby breathes through the umbilical cord. And as soon as it's cut, they start screaming and they start using those beautiful lungs. Well, within the first year, you guys, the first entire year, their lungs are still developing. So we want to make sure that we keep them in areas that have good airflow. We want to keep the toxins down. So that's once again keeping in mind the first presentation we were talking about environment and lifestyle. We want to make sure that baby has clean, healthy air. Temperature control. So this is very important when babies are in cribs. They sleep longer with moms, and I know there's this whole issue with co-sleeping, but I am definitely on team co-sleep, like majority of the rest of the world, because it encourages and it reminds the baby's body to go ahead and maintain a healthy temperature for themselves. Gastrointestinal tract. So even though they're able to suckle and even though they are eating and they are using the restroom, their gastrointestinal tract is not fully developed. And what happens with formula-fed babies is that the formula is so harsh to their intestines, it starts to poke holes through. And so babies get gassy and they get fussy and their stomachs get really bloated. And unfortunately, many babies pass away before their first birthday, and it is related to sepsis. Some babies are getting sepsis. Other babies their immune system is compromised because they're not able to absorb the vitamins and minerals that they need, because once again, they're having holes poked through it. Their renal system and urinary system, there we go. The renal and urinary system is still developing. And so it is normal for a newborn to have one wet diaper for each day of life up to 6 days. A lot of people are focused more on the feces of the infant, but it really, really is about the urinary output, because we are concentrating on their kidney function. We want to make sure that their kidneys are working at their optimal level. And the best way to ensure that would be to breastfeed. Yes. And why? Why do we breastfeed? Why do we want to continue the normal pattern of all mammals? I have to say and make it a point, the Surgeon General of the United States submitted a call to action to the Black community to increase our breastfeeding rates. And as you can see on the left and the right, this is not all the reasons why. These are the key reasons that I picked because I feel they're the most important right now. So evidence has shown from research, it's very clear that breast milk is the best form of nutrition. Why? Because it enhances the immunity of the baby. That means any nasty little microorganisms that are coming to make the baby sick, we can fight them off. Mothers have a beautiful way. If your baby is sick, or mom, if you are sick, you will make antibodies directly related to that illness and pass them to your baby. So what can we call that? We can call that a natural vaccination. You see what I'm saying? Yes, we have that already built in us. It promotes bonding with the baby. So the time that you spend holding them, caressing them, looking them in their eye, talking to them, please remember that they have spent the 9 months with you and you alone. Yes, they recognize and hear other sounds, but they are normally listening to your heartbeat. They are used to hearing your voice. They are used to hearing your breathing. And so let's remember that it can definitely be traumatic to change your environment so swiftly and all of a sudden be pushed to strangers. So a lot of the time we love that family loves to hold them, but for those first 6 weeks, ladies, let's please, advocate for our child in a sense of saying, it's really important for us to transition into other people holding. And I think that is why we are so beautifully designed to be the only form of food for our children. It is a great laxative effect to pass meconium. So meconium is that black, nasty, sticky, tarry poop. It's the first bowel movement. And we definitely don't want the baby to keep any of that in the intestines, because once again, the intestines are not fully developed until about a year out. The suckling helps the mother's womb return to its usual size. So like Kania was talking about, when we're talking about snapback, we're talking about involution. We want that womb to return back to its normal size. And if we assist the body in doing what it's going to do, it tends to look better, it tends to feel better, and it tends to work better. Your milk is designed for the age of the baby. So each week, each month, each day, your milk will be designed particularly for what your baby needs. So at a certain point, your baby's going to need a little bit more fat. Your baby's going to need a little bit more iron over here. Your baby's going to need a little bit more vitamin K. So depending on what your baby needs, your breast will automatically design for the age of the baby. So when you're using formula, it's a standard bottom-based version of what you can design. It also reduces the risk of postpartum hemorrhage. So as we discussed, once again, that Black women you're going to see it a lot more in the media, but this has been something that has been going on since we actually got involved with public health nursing. When midwives were taken out of the homes and they were given standardized training through the government, Black women have been and continue to die from postpartum hemorrhage. And this is happening from 2 to 4 weeks outside of the hospital, and they are not relating it yet to trauma that's withstand or experienced in the hospital, or not breastfeeding. So on the right column, we have not breastfeeding. This increases a mother's risk of breast cancer. Too many of us, along with knowing aunties and aunts who have broken their hips, a lot of us in the Black community have aunts and mothers and sisters and even my generation right now that are battling breast cancer. And what can decrease the risk of breast cancer is breastfeeding your baby. So every child that you have and that you breastfeed, it lowers your rate, your risk of getting breast cancer 4%.
Wow.
Yes. So it's really important when we're thinking about that. I know we love to march and I know we love to, be active, but I really want us to be active a little bit more as far as preventative medicine goes. And breastfeeding is a great source of preventative medicine. Also for our baby girls, as you can see here, it increases the risk of developing breast cancer in a later life. So with you not breastfeeding and you have a baby girl, you increase her chance of getting breast cancer later in life. Science has let us know as well that babies who do not breastfeed have lower IQs. I don't think I have to expand upon that. It's difficult to digest. So as my previous slide showed, that your baby's gastrointestinal tract is not yet fully developed, formula is very hard to digest. So what does that mean? That means that mom, you're going to get less sleep. Dad, you're going to get less sleep. That means you're going to have more trips to the hospital because baby is just going to be, just unhappy, uncomfortable. That's when we deal with acid reflux. That's when, all of these other complications comes because it's number one, not natural. And if formula is in a powdered form, it is not sterile. It cannot be sterilized. So that's something that we don't think about either. It's not clean. That means whatever factory it was in, it can have any type of antigens that can come, has just anything can be in the powdered form of it. It increases the risk of Crohn's disease. Crohn's disease is a digestion disease. So once again, it's about, really designing a healthy life for your child that they can continue to live a good quality of life. If you've ever known someone with Crohn's disease, and I have, it is a very debilitating type of disease because it's an everyday battle of using the restroom. I would do your own research about it, but it's definitely it's not fun. The risk of type 1 diabetes, which requires insulin, your rate skyrockets. A lot of formula has extra sugar inside of it. And once again, like I said, breast milk is designed for the age of the baby. Formula is not. So it is your standardized milk-based formula. So when you're thinking about where it comes from a cow's milk. How large is a cow? Huge. How large is the brain of the cow? Not so huge. So giving our children milk from an animal, we are telling their bodies to design based on that mammal's DNA. And so what we are seeing is a high increase of diabetes and also overweight. Babies are overweight. So we definitely want to prevent that. It increases the risk of ovarian cancer in women. So we want to avoid hysterectomies. We want to avoid cancer at all costs. And these are just this is like literally the tip of the iceberg about the benefits of breastfeeding. So that is the end of my presentation. I would like us to think in regards to postpartum care, to take your time. Take your time with yourself and to take your time with your baby, to be patient with yourself and forgiving with yourself. Be patient with your little one and be forgiving with your little one and everyone else around you that is offering support. Never ever let society define you. And, you know, non-traditional versus traditional, what works for you? There are some traditions that we have adopted for survival. And we're at a point in time where we need to recognize that we need to thrive instead of surviving. And one of those points is that there was once a time within America that Black women were employed as wet nurses, and that was not always paid. And so we are now addressing the taboo and the generational trauma surrounded by breastfeeding and our postpartum care in entirety. We are now changing the narrative. So if you'd like, we're right at 5. Check out the PowerPoint. And I don't know, Kania, should I run it? This is about 5 minutes, or leave it?
No,
go
ahead and if anyone needs to log off, they'll be fine.
All right. Well, I'm gonna go ahead and look. We'll play. I hope you enjoy. Yes. So this is an interview I did. Yeah.
Camera, please. Pause. I'm like, please stop. Hi, my name is Akilah Shaheed, and you are watching Hear My Cry TV, where stories are told, art is bold, and where love is gold. I am from the Bay Area. That's California, Oakland, Richmond, Vallejo. If I give you the city, you really wouldn't know. But I'm from an area where it's okay to be you. I am a doula now. That wasn't always the case. My course was to become a registered nurse. I enrolled at Dillard University, and what happens is life happened. And so I've had to deal with the cards that have been dealt. At 15, I was actually diagnosed with PCOS, which is polycystic ovarian syndrome. It basically means that you're not supposed to have kids. So at 15, I was told by a medical provider that my likelihood of conceiving was slim to none. My second year of college, lies. I was not only on a birth control, a pill form, definitely used a condom for protection. That didn't work, so I definitely used a plan B. And 9 months later, my son came into the world, naturally and unexpected. But my pregnancy, that really took a toll on me mentally, because number one, I was told I couldn't conceive. So here I am, I'm in college, I'm doing what I'm supposed to be, and here this opportunity that I thought was taken from me was given to me, but the timing wasn't right. And so everything pointed to no, yet I knew this was something I might not get a chance to do again, and I was very grateful that I was able to. Not to mention that my body hid my pregnancy from me for about 4 months. None of the urine tests worked, none of the blood work worked, and I was in an area where I didn't have health coverage, so I wasn't able to get an ultrasound before confirming. What I knew the entire time was that I had a child. As you can see, I'm pretty happy-go-lucky, I'm pretty outgoing. When I first became pregnant, I was ecstatic in the privacy of my own home. When I left my house, it was a whole different story. I felt like everyone was staring at me and judging me. I felt like I had made a huge mistake and that I had blocked off so many different opportunities. And that is when I knew it was something other than just a feeling. This was something chemical, spiritual, and physical all in one. And there were definitely layers that just now, my son is 8, just now getting those, being able to identify those and rectify them so that I'm no longer scared. In all honesty, I would follow my intuition. It wasn't like I was alone the whole time. I had a little voice in my head that was reminding me that it's okay. Regardless, I would definitely talk to myself better. I would forgive myself a lot for expectations that other people put on me and on my life. I would stay outside more. Not necessarily where people are, but with nature. Really relax, really get back to the basics. I would take myself off of social media because those come with expectations. Again, that's not needed. So I would really isolate myself, but not in a negative way, meaning I'm hiding from others, but really, really giving myself the time to focus and assess what I needed. That's what I would do.
All right. So thank you. That was a little interview that I did for a nonprofit that's called Please Hear My Cry. And they were asking women about postpartum depression, their experience after pregnancy, their experience within pregnancy, along the perspective of being a single Black female. And so rah to all those like yourself that are deciding to be active and taking their lives in their control. And you know, it's something that we have to talk about. It's a conversation that we have to have. And I think that, you know, culturally, we've always been shushed and we've been labeled like the angry Black woman. But I think the anger comes from not being able to express ourselves freely without feeling that judgment from society. So yes, so we're bashing down those doors, and just be patient and love yourself and take care of yourself. And that's my message.
Woo! I know you have a few more minutes.
Yeah.
Okay. So I have a couple of questions for you.
Yeah. Come on.
Okay. So one of the things you mentioned, where you talked about like how babies transitioning from being in mommy to being out into the world during those first 6 weeks.
Absolutely.
And then at the same time, you talked about needing a lot of support, right?
Yes.
Because we need to heal.
Yes.
And I remember there was an article or something I read about talking about how it's really critical for the dad, or if it's not even the biological dad, but for the male role model to bond with baby during the first 30 to 60 days, because the baby apparently emits magical baby pheromones. I don't know, but they were saying it's chemical, and you're doing this skin to skin. And so I didn't know if you had any insights or thoughts about maybe what that looks like, allowing the men a chance to bond with baby and also be a great support to mommy, or what that looks like.
Yes, I think it looks like how I was explaining earlier, how my dad had to hold me up to my mom's chest. Outside of that, once I was fed, I was burped and my diaper was changed, I would sleep on his chest, skin to skin. So those type of those interactions, I think, are definitely very important. And that goes with anyone that will be a close support system for your child and somebody that you would consider in your village. I think during those, but as our society changes, we don't always have a male there that's active. And so from my perspective, I definitely neglected to mention that within the presentation, but if dad is active, like I said, you guys as dads, you guys are, or as partners, you guys are protectors of the milk supply. That comes with a lot of responsibility because that kind of puts housework, need you guys to step it up, handle the housework so mom can rest and breastfeed. And then in between that, I definitely need you to pick up baby and have skin to skin time. So it's double duty. And that's why it's really important to have someone else that's objective, that may be like a doula, to do light cleaning and housework. So postpartum doulas are coming out the woodworks, thank goodness, and supplying that support. France right now is the only country that I'm aware of that allows and sends somebody to your house for those 6 weeks. 6 weeks to assist with laundry, to assist with household duties, grocery shopping, and everything like that, because they've acknowledged that those first 6 weeks for the couple, for that family to bond is very, very important. And we tend to lose sight of that when, you know, the laundry is piling up and, I forgot to do dishes and I have to do this. So definitely, chemically, you are bonding. If you do share DNA with that child, and even if you don't, you develop that. Energy exchange is very serious and very real. And when you're touching that baby and when you're absorbing it and everything, you know, they are becoming part of you. So even if you're not biologically linked to that child, that would be your opportune and prime time to go ahead and mix your DNA in there. So.
And what else came to me? Okay. So in this, because you talked about womb massage, but not necessarily steaming. And I know a lot of women are concerned about that, not just the snapback externally, but that snapback internally. So the conversation of Kegels and yoni eggs and things like that. At what point can you begin to do some active recovery of your yoni?
Yes, so you can do Kegels immediately, depending upon your comfortability, with no weight. And I call yoni eggs your weight. So I say you want to think of it like, I'm doing this right now. If I do 100 of them, I'm going to gain a little bit of muscle. But if I add a 5-pound weight, I can cut that in half. 6 weeks. After 6 weeks. For vaginal steaming, once again, because it's going to, depending on your custom steam blend, it can also detox your body. You don't want to do that after you've just given birth. You've already lost a lot of fluids. You're trying to replenish. You're trying to learn to breastfeed. And so all of that may end up energetically draining you, because it's going to take toxins from your body, you know what I'm saying, and kind of reset it. So your body's already going through a reset. You don't want to overload your body with herbs and with medicine too. We want to still kind of respect your body and give it that time naturally. So I would not recommend steams until after 6 weeks. I definitely, I have a couple of different tightening blends and gooseberries. Yeah, if you, so gooseberries, I know people are like, what? Gooseberries, if you boil them, the residual mixture that comes after, you can rub onto your vagina, and that will give you the vaginal rejuvenation that women are going out and getting lasers. I would recommend and tell people that wait 5 to 10 years, and you might see that vaginal rejuvenation, just like you see like Yaz on the commercials in the middle of the night, and they're like, if you got, you know, vaginal rejuvenation, you get. So trust me, there's a remedy naturally for everything. It is. So we don't have to go through those extremes. And once again, like, you know, our body naturally goes back. And so yoni eggs are a continual maintenance of that. So after your 6 weeks, go grab you one that speaks to you. Clear quartz is great for everything. Black obsidian is beautiful for removing negative energy, especially if you had any trauma related. I'm gonna do a green jade. And so that means if you hemorrhaged after, if you were like me and your placenta was pulled prematurely, if you ended up having a cesarean, all of that still, your womb still registers that as trauma because there's a natural process that was stopped. And so your body may go into a bit of a shock. So 6 weeks out, I think that that's relatively an okay time for you to start steaming, for you to use yoni eggs as a form of postpartum care and rejuvenation down there. So yeah.
Oh my goodness. Well, thank you so much. I've learned so much. Wow.
Yes.
As we conclude, is there anything else you might want to put in before we wrap up today, or anything you want to share?
just that, like I said, I mentioned I have PCOS or polycystic ovarian syndrome. I have now moved to a completely plant-based vegan diet, and my symptoms have vanquished so much. So for my women out there who are going to the doctors and being told that it's normal, even those women that go and are suffering from bacterial vaginosis and reoccurring issues of within their womb, none of that is normal. So I loved how you were talking about endometriosis earlier, and I want to say everything should be balanced, and it balances. The beginning starts with the womb. So take care of you. That's it.
Well, as we're going to bring it to a close, thank you.
Thank you.
I got a little more housekeeping, and just a few things to share as you were talking and stuff was coming to me. So you guys, we just had the wonderful and the lovely and the super fabulous doula extraordinaire, Miss Akilah Shaheed, share with us about postpartum care and recovery. Those crucial 6 weeks after we deliver. And for me, it was even what to understand what was happening to my body during pregnancy, because we don't get educated about this. So this information to me is it's priceless, because when you know what's happening, I think it becomes a lot less scary. A couple of things that I was just moved to share. One, there are some different things you can get support-wise herbally. One being, this is, what do you call it? This 5W is what I was talking about. There's a lot of good stuff in here, but it's designed specifically to support and tone the uterus. And it's something that you begin taking about 5 weeks before giving birth. When you were talking a little bit about postpartum depression, and of course you want things that are going to be safe and natural. But even now, ladies, if you find yourself in a lot of emotional distress, flower essences are a wonderful, wonderful tool to help bring balance back to yourself, very naturally and very gently. So this distress remedy supports emotional balance. And so if you were someone who might have been dealing with postpartum depression, or even right now dealing with things like PMS or anything else, this is a wonderful remedy, very gentle. And then, of course, essential oils and aromatherapy. This blend for women, people typically think about it for PMS and menopause, but it's very grounding. It has sage in it. It has, what are some of the other, I can't think of the other herbs right now. But these are awesome things to think about using in addition to what I talked about with the Feminine Health Starter Kit. So if you visit my Medicine Woman site, adivamedicinewoman.com/feminine health, you can find out some more information about some things you can be doing to maximize your health and well-being as a woman. Remember, the Fertility Family is here to help you succeed. The goal for this is to educate and empower. I am an active member of the Fertility Family as I'm on my own journey. Every week, we've got live education, we've got coaching and group support. So if you're not a member, we do encourage you to join the family. Our next week, we will have the Dr. Hugh A. Jenkins will be back in the house on the 11th, April 11th. And he will be sharing more great information from a naturopathic doctor point of view around health and well-being. So we'll see you next week, and hopefully see you inside the group in the family. Thank you so much for being with us today. This has been the Fertility Family Live, and this is Kania Kennedy saying, until the next time, be well and stay fabulous. All right, bye-bye.